CT scan film where we'll be seeing some of the very good findings. Now, this is CT scan of the brain because we can very nicely make out this skull, which is dense white. So, dense white skull, whenever it is very clear cut, it means ki it is CT scan on the brain because in MRI, you don't see this much of bright white skull. So, as we can very clearly see that this dense white structure is there, means this is 100% for sure. This is CT scan. Now, what we can see is on the CT scan brain, the dense white structure, what we call it as radio dense. Radio dense means bright white structure is almost always bone or blood or calcification. So only three things usually appear white or very dense white on CT scan. The first is bone, so this is clear cut bone, this is skull. The second is blood, and third one is calcification. Calcification we can very clearly see most of the time in ventricles. I'll show that. So in this film, we can see that white, this is a dense white or a radio dense structure has to be either bone, has to be either blood or calcification. Now, calcification won't appear in very fast manner. Means suddenly the calcifications won't appear. There is no reason why bone should be present here. Okay, this is not a normal structure where the bone should be present. So, sudden onset occurrence of this much of dense white structure has to be blood. So this is very typical of bleed. This particular patient had history of road traffic accident, and he had presented in altered sensorium. So this dense white structure is all blood. This can be traced in each and every film. So this dense white structure is all blood. So this is blood, and this is the reason why the patient has symptoms. So this dense white blood will create some problems for the patient. What are those problems? So we can see in this dense white structure, around this dense white blood, you see there is hypodense or reduced density, means more of a blackish structure, which is edema. So I'll show you. In this structure, we can see that this whitish portion is the blood, but this this part which is blackish is all edema. So normally, the edema or swelling over the brain tissue should not be there, but here the bleeding is here. So the bleeding is crystal clear present in this area, and this is simply causing compression over the adjacent brain area. It is reducing the blood flow, it is reducing the functioning of the nearby brain. So this is bleed, and this is edema, which is very crystal clear. This is edema. The same thing can be seen here as well, that in this we can crystal clear see that there is dense white bleeding, and this is all edema. The blackish or reduced density lesion or structure around this dense white structure is all edema, which is dark. So this is the brain area which eventually keep on dying, and that is the reason why patients may develop convulsions, seizures, or patient sensation keep on worsening. Now the other things that we need to see in this CT scan is usually brain is symmetrical, means brain symmetry is always preserved. Now this is the diameter. The brain midline was supposed to be in this area. So this is more of a center of the film. But because of this mass effect, because of this bleeding and edema around this left side of the brain, this brain had simply pushed the pushed the brain on the opposite side. This is the reason why there is deviation, or there is shifting of the brain towards the right side. So we can see this is the midline. So this midline is completely shifted to the right side, and the shift of the brain can be very clearly noticed. See this diameter and see this diameter. This much is much lesser than this. This is far uh, away from this. So this is the midline. This is the sagittal vein basically, and this there is more of a bulge. So ideally it was supposed to be in this area, but this is completely shifted toward the right side. So there is mass effect, there is edema around the brain, there is swelling around the brain, and the brain is shifted to the opposite side. These are very clearly visible findings on the brain, CT scan of the brain. What other things we can notice? The normal brain on imaging should have very clear, crystal clear sulci and gyri. So this is sulcus. So this structure, this deepening of the brain tissue is sulcus basically. This, this is sulcus. So it means that the brain has space there so that it can occupy. This is all sulcus. I'll simply clear out these things so that you can clearly see this. So this is sulcus. These are all sulci. See here. But on the left side, you cannot make any sulci or gyri. That is because of the significant swelling of the brain. So loss of sulci, gyri, shifting of the brain toward the opposite side. These are all signs of extensive bleed with mass effect, with shifting of the brain toward the opposite side. If you can see the brain, the hyperdense skull can be crystal clear made up to this area only, but not beyond that. That is because this patient has undergone craniotomy, means the part of the skull which was here has been removed so that the brain which is swollen can come out of the skull box, and the brain will get some time as well as some space to relieve the edema. So if you want to relieve the edema swelling over the brain, we remove the piece of bone, we call it as craniotomy, and we operate the patient again and we fix that skull bone after few months, like after 1.5 months or 2 months or 3 months, once the patient condition has settled. So this is the reason why we are not able to see skull bone on this area, because the skull bone is removed and it is usually kept somewhere in the abdominal muscle. Thank you.